Today I want to talk about what exercises are most effective for treating plantar fasciitis. Hi, Dr. Brian McGee, physical therapist with Rexercise. The plantar fascia is simply a piece of connective tissue on the bottom of your foot that helps support your arch. And with overuse, it can get irritated. So for example, the runner who is ramping up their mileage a little too fast. Plantar fascia can't adapt fast enough and gets irritated. Another example is the middle-aged person who is pretty sedentary, has maybe been sedentary for a long time, gets a new job where they're standing a lot. Similarly, the plantar fascia can't adapt fast enough to this new demand and gets irritated. So the first step of treatment is managing this tissue demand. Maybe less running for the runner, maybe less standing for our other patient. From an exercise perspective, the program generally falls into two categories. Exercises for immediate pain relief, and these are mostly stretches, and two stretches in particular. And those exercises meant for long-term recovery. And this is mostly strengthening, particularly strengthening of muscles in the foot and ankle. And we'll go through both of these categories today. Our first stretch is probably the most effective exercise at providing immediate pain relief. So usually folks with plantar fasciitis have their most pain when they stand after some period of being off their feet. So the classic example, they get up in the morning and their first few steps are horrible. Or they're sitting in their office, they've been sitting for a couple of hours, they get up, same thing. Their greatest symptoms occur during those first few steps. So what I advise patients to do is this stretch before they put weight on their feet. So simply cross the affected leg over the unaffected leg, stabilize the heel, you're kind of pushing on the heel bone a bit, grab the toes and pull the toes and foot toward the shin, stretching the bottom of the foot. Hold this for 10 seconds and do 10 repetitions. And pretty much perform this stretch every time you've been sitting for a while and you're about to stand up, or at least twice a day. Our next stretch is a stretch to the calf and plantar fascia, and it's a little bit different in that we have a folded towel under my big toe. The point of that is to prop up the big toe and make sure most of the stretch is going through plantar fascia, ankle, and calf rather than through the arch itself. So otherwise I'm doing kind of a standard calf stretch. I'm keeping my back knee straight, I'm bending my front knee, and I'm just leaning forward until I feel some pull in my calf. And you'll feel a lot more pull with that toe propped up on a folded towel than without. And you'll simply hold this for about 20 seconds and do this 3 or 4 times. And here's just a close-up view of that stretch to give you a little better orientation of where the towel placement should be. Our next exercise is called an arch raise. We're trying to strengthen specific muscles in the foot. So with your foot flat on the floor, simply bring the big toe up to some reference object. In this case, a dumbbell. It might be the wall, it might be a line of grout on the floor, some horizontal reference. And again, with your foot flat, you're simply going to retract the toe from that reference. So see how I'm pulling my foot back and my arch actually raises up a bit. I'm going to hold that for 5 seconds, relax. My foot goes back to the reference point. Again, I retract the foot. Notice my big toe joint is staying down, okay? Hold 5 seconds, relax. Do this 10 times. Pull, hold 5 seconds. See how my arch raises up a bit? We're simply stiffening and strengthening some of the muscles within the foot. We call our next exercise toe yoga. We're trying to increase both foot muscle strength and coordination. What you simply do is alternately lift just the big toe, then the lesser toes. It's kind of tricky. Back and forth. Big toe, small toes. Oh, I can hardly do the small toes. Big toe, small toes. Back and forth for a minute. I can't get the small toes. Our next strengthening exercise is towel crunches. So you'll want to be on a slippery floor like a wood or tile or a linoleum floor, hand towel laid out flat, and you're simply going to try to pull the hand towel towards you in little chunks by crunching the toes. And then as the towel gets completely pulled toward you, simply out and repeat. We're trying to, again, strengthen muscles in both the foot and ankle, a little bit different muscles than our prior arch raise exercise, but you'll want to do this for about a minute at a time. The last exercise in the program is a calf raise progression. It's here that we're really trying to recondition that plantar fascia to withstand the rigors of our activity, whether it's running, some other sport, or a job. We're trying to make it stronger. And so we start a little bit easier and work our way up to a little bit harder. So on a flat surface, both feet, simply doing heel raises. Get the heels up as high as you can. And you'll want to work up to somewhere around 20 to 25 repetitions, about 3 sets. Now once you can do that pain-free, or at least close to pain-free, then go to just the hurt side. But now instead of 20 to 25 reps, go down to 10 to 15. So now calf raises on a flat surface, 3 sets of 10 to 15 reps. Once you can do that pain-free, then calf raises off a surface, off a step, for example, or here I'm using the frame of my bench, but point is my heel will fall beyond the rest of the foot. You'll want something for balance, up and down, and here, rather than 10 to 15 reps, you'll want to go to 8 to 10 reps. So once you can do 3 to 4 sets of 8 to 10 reps of this form of calf raise, you're pretty much ready to go back to whatever it is you do. That's my plantar fasciitis home exercise program. It's what I most often give my patients that I'm treating in the clinic with plantar fasciitis. And again, I want to stress, in the beginning of treatment, we need to address load management. So that athlete that's a runner may be having to decrease running frequency, running duration, running intensity. That person who works at a job where they're standing a lot, anything we can do to decrease the duration of standing. The first phase of treatment has to involve some form of reduction in load on the tissue. The next phase is stretching. That's our immediate pain relief phase. After that, strengthening for a long-term result. I hope you found this video helpful. I hope it helps you get back to what you love to do. Like, subscribe, leave a comment. Let me know how you're doing with your plantar fasciitis treatment, and we'll see you in the next video.